days she just decided to take him in, and he gave him. He said that I'll never come back till you grow up. We'll never see you. We'll never come back, and so that our the prejudice against us will not fall on you. And so this child grew up, and he's today an engineer actually. Meanwhile, Jatin, his father, came into Ashagram and they started their lives, etc. So there are hundreds of such stories in Ashagram. Ashagram really means hope because we thought that it was something about the village of hope. Just to flash forward, today it's very extraordinary because the town which had so much despised them so much today has become really proud of that. It's really the pride of that town. Everybody who visits Barwani is always taken to Ashagram. They own it and they feel proud of it. Now it's people vie to have their children married into Ashagram, into the families of the leprosy patients who were despised. The families who had abandoned them are now being supported by the people living in Ashagram. So it's been a full reversal of roles. So it was a very beautiful story in many ways, and we learned a lot of lessons from them. So somewhere around, I happened to come back a few years later as a collector of the same district, again for a short period, for similar reasons. But during that period, we decided to expand it to other forms of disability. And at some point down the line, so it's got a workshop where other forms of disability are also dealt with. But at some years later, dealing with mental illness and especially with mental hospitals, when I encountered the reality of people who were left by families for 20, 30 years and had nowhere to go, and especially women therefore spend entire lifetimes in these institutions. A feeling was that why don't we bring them into a place like Ashagram? Because that was the whole purpose. Leprosy happened to be one. So basically, you're saying that people whom society completely casts away create an environment in which they can live with dignity and agency, but with protection. And over time, hopefully they'll gain the strength where they will actually be not only productive but dignified, but also actually a model for other people. But since I wasn't there, we took in a few people from the Indore Mental Hospital. But by then, my own understanding of issues of mental illness had also grown, and we decided to then create a community mental health program around Ashagram. So there was a whole set of community health workers who started working in the communities directly, and that's its own story. I hesitate to talk. I mean, this is like trying to say that we did these great things. I don't think we did anything great. It really was that people who are in the most difficult circumstances need only that chance. I think what we did was a very tiny thing. I went on and lived my life and had some minimal engagement. But it was that, what Baba Amte had said, you don't want your charity, I only want a chance. It was creating a space where they could get a chance. It was they who reconstructed their lives, and they did it with extraordinary, courage and resilience and spirit that fills my heart with admiration. So what I wanted to say here was that we're talking about. I have friends who would, say you're talking about another institution, etc. I really want to clarify. I feel that we're dealing with diverse sets of people with diverse sets of problems, and you have to create a whole continuum of care and responses. And of course, most of the care has to be in families and in the community, and that is really where. And first of all, by not by recognizing mental illness to be mental illness and not, as I said, medicalizing suffering. and responding to people who are having real difficulties in their life, helping them cope with those difficulties, to a continuum of care in the community. One of the things that we did in Ashagram was we also created a hospital for people with polio, and then it grew into other aspects. So we got a whole wing created where we said that mental patients who had to come in would not even live in a separate mental ward. They are admitted along with other patients into general wards. And there was no resistance to it. I mean, it was something that was accepted and routinely. And so the patient came in like any other patient and was admitted into mixed wards. And that still continues to today. So, yeah, but coming back, so the idea was only about that in that continuum of care with, you will have some persons with disabilities, with very serious difficulties, whose entire social support systems have broken down. Hopefully, families will continue to care, and families do, in the most difficult of circumstances. In this very room, I know people who have taken care of people with severe mental health and other issues with great love, and there is no substitute for that. But there is a reality that there will be some individuals who have serious mental health and other disabilities who might be abandoned by everybody. The answer is not to let them be. The answer is also not to lock them out. The answer is to create something that allows them the entire freedom and dignity of a person in the open community, but yet does not abdicate responsibility to support them in ways that they need for their support. And it is that very complexly nuanced response to this, to the abandoned, I call them the abandoned seriously, mentally, and perhaps socially, and also socially highly disadvantaged individuals would perhaps need alternate models of community care which are based on this sort of setup. Achal was talking about Snehabhyan. So I just say how this learning applied in another very different context, and I'll end there. When I was joined as country director of ActionAid, just a month or two later, we had this enormous super cyclone in Orissa, where I think 20,000 people lost their lives. And there was enormous number of widows and children who were orphaned. And the fear about both the trafficking and institutionalization of these two segments of vulnerable people was very, very real and very, very imminent. So we went in very quickly with this alternate model, pretty much based on some of the learnings over the years. What we did was that we said that immediately, actually within a week, you talk to widows, and it was really extraordinary that the kind of abuse they started facing almost immediately after the disaster. Because a woman whose husband has died is seen as somebody who has no protection whatsoever. So we kept the women who were widowed and the children who had been orphaned in the center of the village. We created what was called Mamta Griha, which was a large temporary structure where all of them were housed, and in the center of the community. And then we had lay counselors from the community, whom we call Sneh Sathis, who were trained in counseling, and then they had some support from professionals as referrals. Incidentally, Dr. Murthy had done an evaluation of this some years later and found extraordinarily less levels of mental health pathology in this community because of this lay counseling and this support system. But what was interesting was that over the next 6 months to a year, we said that if you wish, an alternative could be for new families to come out of this grouping. And I tried to get a group of feminist friends to go in and spend time helping these people think through these new families and saying, a normal heterosexual family is not the only unit. You can have, 3 women may want to live together, somebody else may want to live together. You'll have many different formations. But largely it is people who in the course of living together in this collective, over the 6 months in this very difficult time, people find each other, let them find each other, and then we constitute them into units which are located right within the village. And then we created Sneha Samitis, which were caring committees of elders, men, women, and some youth, who volunteered to then give special protection to these new families that were created from out of this. It was a very remarkable experiment again, and drew very much from the Ashagram idea, except that here it was really putting